Hi everyone, I welcome you all for this Nursing Wisdom channel. Today we are going to see about OBG MCQ for nursing competitive exams. First question, snowstorm pattern on ultrasound with no fetus or gestational sac is the characteristic of option A, eclampsia, option B, placenta previa, option C, abruption placenta, option D, hydatidform mole. Snowstorm pattern on ultrasound is the characteristics of hydatidform mole. In this condition, a rare mass or growth that forms inside the womb at the beginning of the pregnancy. It is a type of gestational trophoblastic disease. The chorionic villi of a molar pregnancy resemble a snowstorm pattern on ultrasound. So here the answer is option D, hydatidform mole. Next question. During pregnancy, leukorrhea will increase because of the influence of option A, estrogen, option B, progesterone, option C, oxytocin, option D, prolactin. Increased estrogen during pregnancy leads to hyperplasia of vaginal mucosa, which in turn increases the secretion by the endocervical gland. So here the answer is option A, estrogen. Next question, nurse is caring for a patient who is experiencing eclamptic seizure at present. Which among the following is the priority nursing interventions? Option A, maintain patent airway. Option B, administer magnesium sulfate IM. Option C, start IV fluid. Option D, hold the patient tight. Priority nursing intervention is to maintain patent airway. Once seizure is subsided, then IV fluids and other medications will come into play. So here the answer is option A, maintain patent airway. Next question, among the following, which sign indicate that newborn is adapting well with the external environment? Option A, nasal flare. Option B, chest is drawing. Option C, retractions. Option D, respiration rate 40 to 60 breaths per minute. Respiratory rate of 40 to 60 breaths per minute is normal in newborn and is showing the adaptation with extrauterine environment. So here the answer is option D, respiration rate 40 to 60 breaths per minute. Next question. 38-week pregnant mother complaining of discomfort due to irregularly occurring contraction. The best advice by the nurse is option A, lie down in supine position. Option B, take some warm drinks. Option C, walk around. Option D, take some analgesics. Patient experiencing Braxton Hicks contractions. It is also known as prodromal labor or practice contractions or false labor. It is sporadic uterine contractions that sometimes start around 6 weeks into a pregnancy. However, they are not usually felt until the second trimester or third trimester of pregnancy. It can be relieved by walking around until it subsides. So here the answer is option C, walk around. Next question. A neonate has been diagnosed with CEPHALO, which is the incorrect statement regarding the diagnosis? Option A, collection of blood between pericranium and flat skull bone. Option B, it is never present at the time of birth. Option C, swelling is limited by the suture line. Option D, it involves swelling of the tissue over the presenting part of the head. Cephal hematoma, condition marked by soft, fluctuant, localized swelling with well-defined outline, caused by subperiosteal hemorrhage, appears after birth, increases in size for 2 to 3 days. Swelling does not cross suture lines, disappears from several weeks to even months after birth. Complications include defective blood clotting, underlying skull fracture or intracranial bleeding and jaundice. So here option D is incorrect statement. Remaining all the statements are correct. So here the answer is option D. It involves swelling of the tissue over the presenting part of the head. Next question. newborn at risk for developing respiratory distress syndrome. That means RDS is option A, newborn with a period of gestation less than 30 weeks. Option B, newborn of diabetic mother. Option C, newborn who passed meconium in the uterus. Option D, all the above. Causes for respiratory distress syndrome RDS: prematurity, maternal diabetes, meconium aspiration syndrome, cesarean section. Pulmonary causes includes congenital malformation, pneumonia, pleural effusion, edema of lungs, bleeding from lungs. Non-pulmonary causes includes sepsis, exposure to cold, acute blood loss. So here the answer is option D, all the above. Next question, antidote of magnesium sulfate is option A, calcium gluconate, option B, potassium chloride, option C, sodium nitrofrucide, option D, verapamil. Calcium gluconate is the antidote of magnesium sulfate. Client on magnesium sulfate therapy should monitor for deep tendon reflexes and need to assess hourly. Cardiac and renal function is monitored closely. The urine output should be maintained at 30 ml per hour because the medication is eliminated through the kidneys. So here the answer is option A, calcium gluconate. Next question. While measuring fundal height, client complaining of feeling dizzy and light-headed. What is the most appropriate nursing actions? Option A, check the vitals of the client. Option B, check the fetal heart rate. Option C, turn the mother to one side. Option D, check the urine protein level. While measuring fundal height, woman was on supine position and she was experiencing supine hypotension. By changing her position, that means from supine to lateral will help to remove the compression and restore cardiac output and blood pressure. So here the answer is option C, turn the mother to one side. Next question, chief source of estrogen in the third trimester of pregnancy is option A, placenta, option B, corpus luteum, option C, ovary, option D, pituitary. In the early week of gestation, that means before the formation of placenta, corpus luteum will secrete these hormones. But after the formation of placenta, placenta is the chief source of estrogen and progesterone. So here the answer is option A, placenta. Next question. As per WHO, postpartum hemorrhage is defined as blood loss more than dash ml. Option A, 500 ml. Option B, 1000 ml. Option C, 1500 ml. Option D, 2000 ml. PPH, postpartum hemorrhage, blood loss more than 500 ml is defined as PPH. So here the answer is option A, 500 ml. Next question, most common cause of PPH is option A, atonic, option B, traumatic, option C, retained tissue, option D, blood coagulopathy. All the above mentioned options are the causes of PPH, but the most common cause is atonic uterus. In 80% of the cases, the PPH occur because of the uterine atony. So here the answer is option A, atonic. Next question, following delivery, nurse suspect atonic PPH in the client. Which among the following is the priority nursing intervention? Option A, massage the uterus. Option B, administer 10 units of oxytocin. Option C, administer ergometrin. Option D, report to the doctor. The priority nursing intervention is to massage the uterus to induce let-down reflex. Although administration of oxytocin helps to arrest the PPH through uterine contraction, but it is not considered to be a nursing intervention. So here the answer is option A, massage the uterus. Next question, product of conception is viable by dash POG. Option A, 15 weeks. Option B, 20 weeks. Option C, 25 weeks. Option D, 30 weeks. Product of conception is viable by 20 weeks of POG. Lungs is the most immature organ, and by 21 week of gestation, with the help of ventilator parameters, the newborn will be able to survive. So here the answer is option B, 20 weeks. Next question. Neonates born to women infected with hepatitis B should undergo which treatment? Option A, hepatitis B vaccine at birth and 1 month. Option B, hepatitis B immunoglobulin at birth, no hepatitis B vaccine. Option C, hepatitis B immunoglobulin within 48 hours of birth and hepatitis B vaccine at 11 month. Option D, hepatitis B immunoglobulin within 12 hours of birth and hepatitis B vaccine at birth 1 month and 6 months. Hepatitis B immunoglobulin should be given as soon as possible after birth but within 12 hours. So here the answer is option D, hepatitis B immunoglobulin within 12 hours of birth and hepatitis B vaccine at birth 1 month and 6 months. Next question. Pregnant woman who is 4 months pregnant asks the nurse how much and what type of exercise she should get during pregnancy. How should nurse counsel her? Option A, exercise to raise the heart rate above 140 beat per minute for 20 minutes daily. Option B, perform gentle back lying exercises for 30 minutes daily. Option C, try high intensity aerobics but limit session to 15 minutes daily. Option D, walk briskly for 10 to 15 minutes daily and gradually increase this time. Walking briskly for 10 to 15 minutes daily will eliminate pelvic pressure and pain, bloating and discomfort. So here the answer is option D, walk briskly for 10 to 15 minutes daily and gradually increase this time. Next question. On third postpartum day, SEEMA noticed some blood-stained discharge from the vagina of her newborn female baby. The best response from the nurse is option A, call the doctor immediately. Option B, reassure the mother that it is a normal finding. Option C, send blood sample of the newborn for coagulation studies. Option D, assess the newborn for bleeding from other body parts. It is a normal findings and is known as pseudo-menstruation. It occurs because of the withdrawal of maternal hormones. So here the answer is option B, reassure the mother that it is a normal finding. Next question. Which among the following is the characteristics of post-date fetuses? Option A, lethargic and irritable. Option B, areola is not pigmented. Option C, desquamation of the epidermis. Option C, vernix caseosa covering the body. Post-maturity syndrome. Post-mature infants' unique and characteristic appearances by pathologically prolonged pregnancy. Wrinkled, patchy, peeling skin on the palms and soles. Long, thin body suggesting wasting. Long nails. Open-eyed, unusually alert, old and worried looking face. So here the answer is option C, desquamation of the epidermis. Desquamation means skin peeling. Next question. Which among the following is the potentially harmful side effect of epidural anesthesia? Option A, hypotension. Option B, headache. Option C, decreased urine output. Option D, increased respiration. Hypotension is the potentially harmful side effect of epidural anesthesia as it causes placental insufficiency by decreasing perfusion to the placenta. So here the answer is option A, hypotension. Next question. Immunoglobulin present in breast milk is option A, IgA. Option B, IgD. Option C, IgG. Option D, IgM. IgA provides immunological defense to the newborn and is present in breast milk. So here the answer is option A, IgA. Next question. USG of a pregnant woman with placenta previa shows that placenta reaches the margin of internal os and is not covering it. The degree of placenta previa is option A, low-lying, option B, marginal, option C, incomplete, option D, total. There are 4 types of placenta previa. Type 1, the lower margin of the placenta dips into the lower segment, that is called as low implantation. Type 2, the placenta reaches the internal os when closed but does not cover it. It is called as marginal placenta previa. Type 3, the placenta covers the internal os when closed but not when fully dilated. This type is called as partial or incomplete placenta previa. Type 4 is the placenta covers the os even when the cervix is fully dilated. This type is called as central or complete placenta previa. So here the answer is option B, marginal. Next question. All the below statements are correct regarding abruption placenta except option A, placenta is in upper segment of the uterus. Option B, always revealed bleeding is there. Option C, bleeding is dark red in color. Option D, painful bleeding is present. In abruption placenta, the bleeding can be revealed or concealed type. So option B is incorrect statement. So here the answer is option B, always revealed bleeding is there. Next question. As per WHO, anemia in pregnancy will diagnose if the hemoglobin level option A 10 gram per dl or less, option B 11 gram per dl or less, option C 12 gram per dl or less, option D 13 gram per dl or less. Anemia in pregnancy will diagnose if the hemoglobin level is less than 11 gram per dl or less. But during pregnancy, hemodilution occur. So hemoglobin 10 gram per dl or less is considered as anemia during pregnancy. So here the answer is option A, 10 gram per dl or less. Next question. Which among the following is correct regarding iron supplementation? Option A, take it along with milk. Option B, take it along with lemon juice. Option C, take it along with water. Option D, take it after having food. Acidic environment promote iron absorption. Lemon juice provide acidic medium which promote absorption of drug. Orange juice can be also take. Taking iron preparation in empty stomach will also promote its absorption. So here the answer is option B, take it along with lemon juice. Next question. As per WHO, breastfeeding need to initiate within dash minute after delivery. Option A 20 minutes, option B 30 minutes, option C 45 minutes, option D 60 minutes. Breastfeeding needs to initiate within 30 minutes following delivery. So here the answer is option B 30 minutes. Next question. Most widely used oral iron preparation during pregnancy is option A ferrous gluconate, option B ferrous sulfate, option C ferrous fumarate, option D ferrous succinate. Most widely used iron preparation is ferrous sulfate. It contains 200 mg ferrous sulfate which contain 60 mg elementary iron. So here the answer is option B ferrous sulfate. Next question. Complication of tocolytic agent is option A uterine rupture, option B hyperstimulation of uterus, option C increased peristaltic movement, option D pulmonary edema. Pulmonary edema is the most common adverse effect associated with tocolytic agents. So here the answer is option D pulmonary edema. Next question. Hazard associated with gestational diabetes is option A polyhydramnios, option B macrosomia, option C birth trauma, option D all the above. Complication to mother, premature contractions, impact on your blood pressure, abnormal amniotic fluid, urinary and vaginal infections, bleeding at delivery. For baby, large baby, obesity, fetal distress at delivery, trauma at birth, brain development delay. So here the answer is option D, all the above. Next question, find out the absolute indication for elective cesarean section. Option A, uncorrectable abnormal lie. Option B, placenta previa. Option C, previous vertical cesarean section. Option D, all the above. Indication for cesarean section. Absolute indications are vaginal atresia, advanced carcinoma of cervix, cervical or broad of contracted pelvis, severe degree of contracted pelvis. Relative indications are cephalopelvic disproportion, previous uterine scare, fetal distress, malpresentation, antepartum hemorrhage, elderly primigravida, chronic hypertension, diabetes and pelvis atresia. So here the answer is option D, all the above. Next question, which drug is choice for the management of menorrhagia? Option A, tranexamic acid. Option B, prostaglandin. Option C, iron sucrose injection. Option D, oral contraceptive pills. Oral contraceptive pills are the choice for menorrhagia. So here the answer is option D, oral contraceptive pills. Next question, vertical transmission of HIV is more commonly occur during option A, antenatal period. Option B, intranatal period. Option C, postnatal period. Option D, equal chance in all stage. HIV is more commonly transmitted during intranatal period. So here the answer is option B, intranatal period. Next question, instrument used for collection of pap smear is option A, iris spatula. Option B, Piper forceps. Option C, sponge forceps. Option D, Simpson's forceps. Iris spatula is used for the collection of pap smear. So here the answer is option B, iris spatula. Next question, most ideal pelvis is option A, gynecoid. Option B, anthropoid. Option C, platypelloid. Option D, android. Gynecoid pelvis is most ideal pelvis for normal delivery. Features of gynecoid pelvis includes brim rounded, forepelvis generous, side walls straight, ischial spine blunt, sciatic notch rounded, subpubic angle 90 degree, incidence 50%. So here the answer is option A, gynecoid. Next question, under USG guidance, fetal blood sampling is performed in the option A, umbilical artery. Option B, umbilical vein. Option C, placenta. Option D, iliac vein. Fetal blood sampling is performed in umbilical vein. So here the answer is option B, umbilical vein. Next question, mini lap is a procedure related to option A, family planning. Option B, cervical cancer. Option C, cesarean section. Option D, normal labor. Mini lap is a procedure related to family planning. In this, OPD basis tubectomy will be performed. So here the answer is option A, family planning. Next question, function of progesterone is option A, prepare the uterus to receive the fertilized egg. Option B, secondary sexual characteristics. Option C, milk production. Option D, stimulation of ovary. The main function of progesterone is to prepare the uterus to receive the fertilized ovum. So here the answer is option A, prepare the uterus to receive the fertilized egg. Next question, antiretroviral therapy, that means ART of choice for the newborn born to HIV positive mother is option A, nevirapine. Option B, lamivudine. Option C, entecavir. Option D, ritonavir. The drug of choice for the newborn born to HIV positive mother is nevirapine. So here the answer is option A, nevirapine. Next question, blood choice for exchange transfusion in newborn is option A, RH negative blood of same group baby. Option B, O negative. Option C, both A and B. Option D, same blood group of that newborn. RH negative of same blood group is recommended If it is not available, then O negative blood. So here the answer is option C, both A and B. Next question, which among the following condition is seen often in patient with gonorrhea? Option A, trachoma. Option B, chlamydia. Option C, kerphus. Option D, syphilis. Most women who are suffering from gonorrhea will be also having chlamydia. So treatment of both conditions is required simultaneously. So here the answer is option B, chlamydia. Next question, the single umbilical artery is most common in option A, oligohydramniosis. Option B, placenta previa. Option C, twins. Option D, all of the above. Monochorionic monozygotic twins is the condition in which there will be single umbilical artery. So here the answer is option C, twins. Next question, which of the following stages of labor would the nurse assess crowning? Option A, first stage. Option B, second stage. Option C, third stage. Option D, fourth stage. Birth crowning, which when baby's head starts to emerge bit by bit during each contraction, occurs during the second stage of labor. So here the answer is option B, second stage. Next question, mother has given with opioid during labor process. Which among the following drug most commonly ordered by doctor for the newborn baby? Option A, naloxone. Option B, morphine. Option C, calcium gluconate. Option D, adrenaline. Use of opioid cause respiratory depression in newborn baby. The antidote naloxone will be ordered by the doctor for newborn baby. So here the answer is option A, naloxone. Next question, color of amniotic fluid in postpartum pregnancy is option A, colorless. Option B, golden. Option C, saffron. Option D, brown. Color of amniotic fluid. Saffron colored amniotic fluid indicate post-maturity. Green colored amniotic fluid indicate meconium. Golden colored amniotic fluid indicate RH isoimmunization. Red colored amniotic fluid indicate abruption. Tobacco juice colored amniotic fluid indicate intrauterine death. White with flakes color amniotic fluid is normal color. So here the answer is option C, saffron. Next question, during each antenatal checkup, weight, blood pressure and fundal height need to be documented. What is the another parameter need to monitor? Option A, determining the client's RH factor. Option B, evaluating the client for edema. Option C, measuring the client's hemoglobin level. Option D, obtaining pelvic measurements. Need to evaluate the client for edema because edema is the indication for preeclampsia. So here the answer is option B, evaluating the client for edema. Next question, all are true regarding vernix gaseosa except option A, secreted by sebaceous gland. Option B, mixture of sebum and epidermis. Option C, appear like white covering over the skin. Option D, it is distributed uniformly. Vernix gaseosa, this is a soft, white, cheesy, yellowish cream on the infant's skin at birth. It is caused by the secretions of the sebaceous glands of the skin. It offers protection from the watery environment of the uterus. It absorbed in the skin after birth and serves as a natural moisturizer. If there is a large amount of vernix gaseosa present, it should be meticulously removed as it is thought to be a good culture medium for bacteria. So here the answer is option D, it is distributed uniformly. Next question, cardinal movement occur before expulsion is option A, engagement. Option B, crowning. Option C, internal rotation. Option D, external rotation. Cardinal movements of labor, engagement, descent, flexion, internal rotation, extension, external rotation, expulsion. So here the answer is option D, external rotation. Next question, after the closure, foramen ovale become option A, ligamentum venosum. Option B, fossa ovalis. Option C, ligamentum teres. Option D, ligamentum arteriosum. After birth and closure of foramen ovale, it becomes fossa ovalis. The fossa ovalis is a depression in the right atrium of the heart at the level of the interatrial septum, the wall between right and left atrium. The fossa ovalis is a thin fibrous sheet that covered the foramen ovale during fetal development. So here the answer is option B, fossa ovalis. Next question. After the birth, umbilical arteries are called as option A, ligamentum venosum. Option B, umbilical ligament. Option C, ligamentum teres. Option D, ligamentum arteriosum. After the birth, umbilical arteries are called as umbilical ligament. So here the answer is option B, umbilical ligament. Next question. Sodium and water retention occur during pregnancy because of option A, increased ADH. Option B, increased aldosterone. Option C, increased estrogen and progesterone. Option D, all the above. Increased ADH, increased aldosterone, increased estrogen and progesterone are the reason for sodium and water retention during pregnancy. So here the answer is option D, all the above. Next question. Hormone responsible for ovulation is option A, FSH, option B, LH, option C, estrogen, option D, progesterone. LH hormone is responsible for ovulation. Luteinizing hormone is a hormone produced by gonadotrophic cells in the anterior pituitary gland. In females, an acute rise of LH triggers ovulation and development of the corpus luteum. So here the answer is option B, luteinizing hormone. I hope you will find this video useful. Thanks for watching.